My name is Martin Schalling. I work as a professor at the Karolinska Institutet in Stockholm, Sweden. This is a state university that focuses on life sciences. The Karolinska Institutet is a world-class medical university that covers all aspects of medicine and health. It is closely associated with the healthcare system in Stockholm, Sweden, and it has a focus that ranges from the very molecular preclinical sciences to the very clinical sciences. In terms of COVID-19, I think it took us all off guard in a way. One of the learning messages is that we need to collect information and knowledge in a more systematic way for the next pandemic, for the next catastrophe, for the next unforeseen event. So I think that many academic institutions are advised to build up centers of knowledge that relate to unforeseen catastrophes. These could be like the recent earthquake in Turkey or like the COVID-19 pandemic. What is for sure is that this was not the last pandemic that we see on this planet. I just related to the fact that we need centralized sources of information. I also think that we could do better in terms of having knowledge about viral infections in general, and what has been quite clear when it comes to COVID-19 is the post-COVID problems that were not appreciated initially. And there is a lot of knowledge that needs to be gathered around what really is it that produce the problems that we see post-COVID. Other tools that are important have to do with reducing the risk of transmission of an infectious agent such as a virus. This could have to do with digital technologies. And I think India has a special place here with a very strong IT development that has been going on for a long time in India. One example would be development of telemedicine or ways to be able to handle infected individuals at the point of care so that you can do more of monitoring, more of treatment, more of oversight in the home environment. Another aspect that I've been personally involved in is breaking down the communication barriers. We had a problem during the pandemic with medically certified translators between different languages that were going from bed to bed to bed, helping patients, but at the same time becoming a vector themselves for the transmission of disease, or at least a potential vector. We have been developing something called Care to Translate, which is a digital translator which translates from one language to the other in a medically correct way. And that you can envision many such tools in the future that help with the digital revolution of healthcare. So the question of post-COVID fatigue has been of interest in our laboratory over the past couple of years, and we just recently published a paper in one of the Nature journals called Molecular Psychiatry, where we describe how a COVID infection in something called an organoid, which is a stem cell derived mini brain that we have in the culture dish. And when this little mini brain gets infected with the COVID virus, we have observed that there is an activation of the cellular cleaning system of the brain, cells called microglia. As a result of this activation, there is a pruning process. The pruning means that synapses are being lost, the connection points between nerve cells. And when this happens, you reduce the connectivity between nerve cells in the brain, and it's very likely, at least, that this is a strongly contributing factor to the post-COVID fatigue and the cognitive difficulties that we often see for a long time post-COVID. And I think one of the learning messages here is that during COVID, we learned that we needed anti-inflammatory drugs to curtail the inflammation. We needed drugs that thin out the blood to avoid blood clots. But we may also need drugs that inhibit these microglia to reduce the pruning and the accidental loss of connectivity in the brain. So one of the reasons that people became very ill during the early phases of the COVID pandemic was an overactive immune system. Something that had been described already at the Karolinska during the swine flu about 15 years ago. So the same principles were being applied by using steroids or other drugs that curtail the immune system. And that in itself resulted in a better prognosis for the patient, because the primary problem in some of these patients was not so much the virus as the immune system's very strong reaction to the virus.